Are you struggling to figure out how to pass the Nclex in as few questions as possible? What if I told you it's not about luck, it's about strategy? In this video, I'll walk you through 50 high-yield Nclex questions with the exact answers, rationales, and test-taking strategies I used to pass the Nclex in just 50 questions. Stick with me until the end, because you'll learn the critical thinking hacks that can make the difference between failing at 145 questions or walking out competently after 50. 1. A client is receiving morphine sulfate for post-op pain. Which finding requires the nurse's immediate action? A. Urine output 30 milliliters per hour. B. Respiratory rate 8 breaths/min. C. Pain scale 6 out of 10. D. Pupils equal and reactive. Answer, B. Rationale, RR less than 10 indicates opioid-induced respiratory depression. Strategy, always prioritize ABCs, airway and breathing problems first. 2. A client on warfarin has an INR of 6.0 and mild bleeding from gums. What is the priority action? A. Administer vitamin K per protocol. B. Hold warfarin and recheck INR next week. C. Apply local pressure to gums only. D. Increase dietary vitamin K. Answer, A. Rationale, 6 Indian rupees equals high bleeding risk, vitamin K, phytonadione, reverses warfarin. Strategy, for critical lab values with bleeding risk, think reversal/antidote. 3. A newly admitted client is drooling, has stridor and a high fever, priority nursing action? A. Obtain blood cultures. B. Prepare for intubation and notify provider. C. Administer antipyretic. D. Start 4 fluids. Answer, B. Rationale, stridor plus drooling suggests impending airway obstruction, secure airway first. Strategy, airway first, intervene early for any signs of airway compromise. 4. Which client should the nurse see first? A. Stable chronic COPD patient with O2 sat 93%. B. Post-op day 1 abdominal surgery with new onset confusion. C. Diabetes with scheduled insulin due in 30 minutes. D. Discharged client with wound dressing to change. Answer, B. Rationale. New onset confusion post-op may indicate hypoxia, sepsis, hemorrhage, urgent. Strategy, new acute changes in mental status are high priority. 5. A newborn's APGAR at 1 minute is 4. Which action is highest priority? A. Encourage skin-to-skin with mom. B. Initiate resuscitation measures, stimulate, airway, O2. C. Administer vitamin K injection. D. Delay feeding for 2 hours. Answer, B. Rationale, APGAR 4 suggests need for immediate resuscitation and stabilization. Strategy, newborns, ABC/resuscitation over routine care. 6. A client taking lisinopril reports a dry cough and dizziness. What should the nurse advise? A. Continue medication, cough is expected. B. Stop medication immediately and start beta blocker. C. Contact provider, possible ACE inhibitor side effects, cough, hypotension. D. Take with milk to reduce cough. Answer, C. Rationale, dry cough and dizziness are ACE inhibitor adverse effects, provider may switch to ARB. Strategy, recognize common med side effects and when to report. 7. A patient with CHF has sudden weight gain of 4 pounds in 24 hours and increased dyspnea. Best next action? A. Increase daily exercise. B. Notify provider, signs of fluid overload/acute decompensation. C. Encourage low-sodium diet starting tomorrow. D. Give PRN analgesic. Answer, B. Rationale, rapid weight gain plus dyspnea indicates fluid overload requiring urgent treatment. Strategy, weight trends plus respiratory changes equals potential decompensation. 8. Which is the best method to prevent medication errors on a busy unit? A. Rely on memory and speed. B. Use 2 patient identifiers and perform a barcode scan before administration. C. Only give meds during day shifts. D. Delegate all med passes to techs. Answer, B. Rationale, 2 identifiers plus scanning reduces errors. Strategy, think systems level safety, checks, double identifiers. 9. A client with suspected bacterial meningitis should receive which action first? A. Start broad-spectrum 4 antibiotics after blood cultures. B. Lumbar puncture before antibiotics. C. Give oral analgesic for headache. D. Obtain head CT only. Answer, A. Rationale, if meningitis suspected an LP would delay antibiotics, give broad-spectrum 4 antibiotics after cultures. Strategy, when infection is suspected and delay is harmful, treat promptly after blood cultures. 10. A diabetic client with nausea and vomiting is lethargic and Kussmaul respirations. Which lab to check first? A. Serum potassium. B. Serum sodium. C. Arterial blood gas and glucose, check for DKA. D. Hemoglobin A1C. Answer, C. Rationale, Kussmaul respirations plus vomiting in DM suggest DKA, need ABG and glucose immediately. Strategy, recognize metabolic acidosis signs, check ABG/glucose first. 11. A client in droplet precautions with influenza needs a chest X-ray. Which action is correct? A. Bring the client to X-ray without a mask. B. Nurse and client wear surgical masks during transport. Notify radiology. C. Cancel X-ray until isolation lifted. D. Only transport if client refuses treatment. Answer, B. Rationale, use masks and notify receiving department to minimize spread. Strategy, for contagious patients, apply appropriate PPE during transport. 12. Which lab change indicates digitalis toxicity risk in a client taking digoxin? A. Potassium 3.0 milliequivalent/L. B. Sodium 140 milliequivalent/L. C. Calcium 9 mg per deciliter. D. Magnesium 2.0 mg per deciliter. Answer, A. Rationale, hypokalemia increases risk of digoxin toxicity. Strategy, no electrolyte interactions with cardiac meds. 13. Which is the best delegation to a nursing assistant? A. Assess a new admission's neurostatus. B. Obtain a routine vital signs and record intake/output for a stable post-op client. C. Teach discharge meds to a client. D. Administer insulin. Answer, B. Rationale, vitals and INO for a stable client are within assistive personnel scope. Strategy, use delegation rules, stable tasks UAP, assessment/teaching/meds RN. 14. A client with chest pain has ST elevation on ECG, priority nursing action? A. Give sublingual nitroglycerin and prepare for reperfusion, PCI. B. Schedule echocardiogram for tomorrow. C. Give aspirin and wait 6 hours. D. Encourage rest only. Answer, A. Rationale, STEMI requires immediate reperfusion therapy after initial meds, aspirin, nitro per protocol. Strategy, recognize STEMI, act quickly, MONA first steps, PCI/cath lab. 15. Which sign most indicates increased intracranial pressure, ICP? A. Dilated non-reactive pupil on one side. B. Mild headache relieved by analgesic. C. Warm flushed skin. D. Slight increase in appetite. Answer, A. Rationale, unilateral dilated non-reactive pupil suggests cranial nerve compression from increased ICP. Strategy, neuro red flags, pupillary changes, decreased LOC, Cushing's triad. 16. A psychiatric client says, I plan to hurt myself tonight. Best immediate action? A. Ask whether they have a specific plan and means, initiate suicide precautions. B. Tell them it will be okay and leave them alone. C. Schedule therapy next week. D. Give PRN anti-anxiety med and go home. Answer, A. Rationale, direct statement of intent requires immediate assessment of plan, means, and initiation of precautions. Strategy, always assess lethality, plan, means, timeframe, and ensure safety. 17. Which is the correct action before administering blood? A. Verify patient identifiers and blood product with another RN at bedside. B. Start infusion without checking if policy allows. C. Only check name band later. D. Give through running 4 fluids to dilute. Answer, A. Rationale, 2-person verification at bedside prevents transfusion errors. Strategy, for high-risk procedures, blood, follow double-check policies. 18. A client on heparin infusion has platelets drop from 250K to 90K. What is immediate concern? A. Heparin-induced thrombocytopenia, HIT, stop heparin and notify provider. B. Continue heparin, slight drop is normal. C. Start aspirin immediately. D. Increase heparin dose. Answer, A. Rationale, greater than or equal to 50% platelet drop suggests HIT, stop heparin to prevent thrombosis. Strategy, sudden platelet fall on heparin equals stop and act. 19. A 2-year-old with dehydration has dry mucous membranes, sunken fontanelle, decreased tears. Best initial action? A. Begin oral rehydration solution if tolerating, 4 fluids if severe. B. Offer ice cream for calories. C. Delay fluids for 6 hours. D. Give antidiarrheal medication. Answer, A. Rationale, signs indicate moderate to severe dehydration, rehydrate, oral if mild moderate, 4 if severe. Strategy, pediatric dehydration prioritize rehydration and assess severity. 20. A client with neutropenia, ANC 400, develops a fever 38.5 degrees Celsius. The nurse should A. Notify provider and prepare to start broad-spectrum 4 antibiotic stat. B. Wait 24 hours to see if fever resolves. C. Give acetaminophen and send home. D. Encourage rest only. Answer, A. Rationale, febrile neutropenia is a medical emergency, prompt antibiotics reduce mortality. Strategy, immunocompromised plus fever equals act fast. 21. Which insulin should the nurse administer intravenously for DKA? A. Regular insulin. B. Insulin glargine, long-acting. C. Insulin NPH. D. Insulin detamir. Answer, A. Rationale, only regular insulin is given for DKA management. Strategy, no common insulin types and routes, short/regular for 4. 22. A client on lithium has tremors, ataxia, and vomiting. Serum lithium is elevated. Priority action? A. Hold lithium, notify provider, may require dialysis for severe toxicity. B. Give a hypnotic to reduce tremors. C. Encourage high sodium diet immediately. D. Continue lithium and recheck in a month. Answer, A. Rationale, neuro-GI symptoms indicate lithium toxicity, medication held and emergent care. Strategy, recognize toxic med levels and act to stop exposure. 23. A client with COPD is on continuous oxygen 2 liters per minute. Which change warrants immediate assessment? A. O2 sat 92% with new confusion and somnolence. B. Productive cough with yellow sputum. C. Mild ankle edema. D. Reports thirst. Answer, A. Rationale, hypercapnia or hypoxia may present with confusion in COPD, assess ventilation/oxygenation. Strategy, mental status changes in respiratory patients equals urgent. 24. A client with chest tube has continuous bubbling in the water seal chamber. Nurse should A. Assess for an air leak in the system, continuous bubbling equals leak. B. Clamp the tube immediately. C. Strip the tube frequently to maintain patency. D. Disconnect the system to check tubing. Answer, A. Rationale, continuous bubbling indicates an air leak, find the source. Do not clamp unless ordered. Strategy, no normal versus abnormal chest tube findings, titling versus continuous bubbling. 25. Which vaccine should be avoided in pregnancy? A. Inactivated influenza vaccine, IM. B. TDAP, inactivated, during pregnancy per guidelines. C. Live attenuated MMR vaccine. D. Hepatitis B vaccine. Answer, C. Rationale, live vaccines, MMR, are contraindicated during pregnancy. Strategy, live equals avoid in pregnancy, inactivated is usually safe. 26. A client with suspected pulmonary embolism suddenly becomes hypotensive and diaphoretic. Immediate nursing priority? A. Call for rapid response and prepare for possible hemodynamic support. B. Give oral anticoagulant immediately. C. Sit patient upright and send home. D. Encourage coughing and deep breathing. Answer, A. (32) What's the best technique to improve retention when studying for NCLEX? A. Active recall, practice questions plus spaced repetition. B. Passive reading only once. C. Cramming the night before exclusively. D. Listening to lectures at 0.5x speed only. Answer, A. Rationale, active recall and spaced repetition are evidence-based study strategies that improve long-term retention. Strategy, teach study habits as test-taking strategy, practice questions plus spaced review. 33. A wound culture returns MRSA. What isolation is appropriate? A. Contact precautions, gloves and gown. B. Droplet precautions only. C. Airborne isolation. D. No precautions necessary. Answer, A. Rationale, MRSA is spread by contact, use contact precautions. Strategy, match pathogen transmission mode to precautions. 34. For a client before a colonoscopy, which medication should be held to reduce bleeding risk? A. Warfarin. B. Acetaminophen. C. Regular multivitamin. D. Levothyroxine. Answer, A. Rationale, anticoagulants are often held pre-procedure to reduce bleeding, follow provider instructions. Strategy, pre-procedure med reconciliation, identify anticoagulants/antiplatelets. 35. A patient reports chest pain and is allergic to aspirin, anaphylaxis history. Which antiplatelet alternative might be used initially? A. Give clopidogrel per provider order if aspirin is contraindicated. B. Give aspirin anyway since it's standard. C. Give ibuprofen instead as antiplatelet. D. No antiplatelet needed in acute coronary syndrome. Answer, A. Rationale, if true aspirin allergy, alternative antiplatelet, clopidogrel, may be used per protocol. Strategy, no alternatives when standard therapy contraindicated, always confirm allergy history. 36. A postoperative client is drooling and can't swallow secretions. What should the nurse do first? A. Suction airway and position to protect airway, call rapid response if needed. B. Offer water to help swallow. C. Encourage coughing only. D. Document and recheck in 2 hours. Answer, A. Rationale, inability to manage secretions indicates threatened airway, suction and positioning first. Strategy, protect airway immediately for any swallowing/airway compromise. 37. Which lab value is most important to check before starting a statin? A. Liver function tests, ALT/AST. B. CBC only. C. Serum potassium. D. Hemoglobin A1c. Answer, A. Rationale, statins can affect liver enzymes, baseline LFTs recommended. Strategy, for med start, no key baseline labs to monitor for adverse effects. 38. An older adult with Alzheimer's is agitated at night. Which non-pharmacologic strategy is best first? A. Reorientation, decrease noise, provide night light and consistent routine. B. Give high-dose antipsychotic immediately. C. Restrain for safety. D. Force daytime naps only. Answer, A. (41) A client with sepsis is hypotensive despite fluids. Which intervention will the nurse expect? A. Start vasopressor infusion, e.g., norepinephrine, per protocol to maintain MAP. B. Stop all antibiotics. C. Send home with oral fluids. D. Give antipyretic only. Answer, A. Rationale: septic shock with refractory hypotension requires vasopressors to maintain perfusion. Strategy: in severe sepsis/septic shock, think vasopressors after fluids. 42. A client on methotrexate presents with sore throat and fever. What is priority? A. Suspect bone marrow suppression, notify provider and assess WBC/ANC. B. Continue methotrexate and reassure. C. Give over-the-counter cold meds at home. D. Increase methotrexate dose. Answer, A. Rationale: methotrexate can cause marrow suppression and immunosuppression. Fever and sore throat warrant evaluation. Strategy: with chemo/MARDs, any infection signs require prompt assessment. 43. Which technique reduces risk of ventilator-associated pneumonia, VAP? A. Elevate head of bed 30 to 45 degrees and daily sedation vacation/assess readiness to extubate. B. Leave patient flat for comfort. C. Avoid oral care to prevent aspiration. D. Routinely change ventilator circuits every 8 hours. Answer, A. Rationale: elevation and sedation breaks reduce VAP risk. Oral care is also important. Strategy: use bundles, HOB elevation, oral care, sedation pause, to prevent VAP. 44. A client on aminoglycoside antibiotic reports tinnitus. What should nurse do? A. Notify provider, aminoglycoside ototoxicity possible, may need drug change. B. Advise that tinnitus is normal and continue treatment. C. Double the dose for better effect. D. Administer antihistamine only. Answer, A. Rationale: tinnitus may indicate ototoxicity, discontinue or adjust dose as needed. Strategy: recognize early signs of drug toxicity and act. 45. Which is most important to teach a client who will take oral alendronate, bisphosphonate? A. Take with full glass of water and remain upright 30 minutes to prevent esophageal irritation. B. Take at bedtime with snack. C. Crush and mix with applesauce daily. D. Stop calcium supplements entirely. Answer, A. Rationale: upright position and full water reduce esophageal irritation and ulceration risk. Strategy: patient teaching for meds, no key administration precautions. 46. A client with Parkinson's disease becomes rigid and febrile with autonomic instability after abruptly stopping levodopa. This is likely: A. Neuroleptic malignant-like syndrome or Parkinsonism hyperpyrexia, emergency. B. Normal fluctuation of symptoms. C. A mild cold. D. Withdrawal unrelated to levodopa. Answer, A. Rationale: sudden withdrawal of dopaminergic therapy can precipitate life-threatening syndrome. Strategy: know severe withdrawal syndromes and treat urgently. During a code, the nurse is assigned to chest compressions. What is correct technique? A. Use 2 hands, compress at least 2 inches 5 centimeters at 100-120/min allowing full chest recoil. B. Compress as fast as possible without recoil. C. Use only one hand for all adults. D. Stop compressions for rhythm checks every 10 seconds. Answer, A. Rationale: high-quality compressions require correct depth, rate, and full recoil. Strategy: know CPR basics, depth, rate, minimize interruptions. 49. Which electrolyte disorder is most associated with tetany and positive Chvostek sign? A. Hypocalcemia. B. Hyperkalemia. C. Hypernatremia. D. Hypomagnesemia, without calcium changes. Answer, A. Rationale: hypocalcemia leads to neuromuscular excitability, tetany, positive Chvostek. Strategy: link classic signs to electrolytes, memorize high-yield associations. 50. Which is the best final step in your NCLEX test day strategy? A. Review marked questions if time allows, then submit. Trust trained instincts and avoid random guessing, use educated elimination. B. Leave many questions unanswered to save time. C. Change all answers to be at the end. D. Panic and rush through the last 10 questions. Answer, A. Rationale: best practice, review flagged items if time allows, use elimination, and trust studied strategies. Nclex uses CAT, answer each thoughtfully. Strategy: test taking psychology, stay calm, use elimination, manage time, review if able. If you've made it this far, you now have the same strategies I used to crush the NCLEX in 50 questions. Remember, it's not about memorizing every fact, it's about mastering how to think like the NCLEX. Backhand index pointing right. If you found this helpful, hit the subscribe button and turn on the bell, because I've got more NCLEX practice videos coming that you don't want to miss. And before you go, check out this next video on priority questions for NCLEX. Who do you see first? It's one of the most tested areas, and it could be the key to getting your computer to shut off early on exam day.